the Health Department will stop its daily COVID-19 reporting. It will now publish surveillance data on a weekly basis. This, they say, is a result of reduced severity and transmissibility and also declining cases. Officials have, however, warned that this does not mean that the pandemic is over. Let's discuss this with medical specialist Dr. Angelique Coetzee. Doctor, thank you so much for joining us this afternoon on ENCA. What are your thoughts? You think this is a good move by the NICD?
Good afternoon, Dan. Yes, in a way, it's a good move in this way that I don't think people listen to the stats anymore. I don't think, if you go out and you ask people in the streets, have they looked at this latest stats? I'm quite sure you will get an answer of no, we don't look at it anymore, we're over COVID. The problem, however, is that we're still in the pandemic. And we are expecting, if we look at the pattern of the past 2 years, we are expecting a next wave in September. Whether it will happen or not, we're not sure. But looking at the history of the virus, this will be the month that we can expect our next wave in South Africa. So it is important to make sure that the average public out there understands that we're not out of the woods, although our numbers are low, as to be expected in between waves, as what we are seeing now, and that's the correct thing, it must be low now. However, if there's a new variant, whether it's a new variant or a subvariant, we won't know. We will only begin to understand once if we go into a next wave.
But Doctor, when you mention if there's a new variant, surely we'll still have the same, the same resources and some of the same infrastructure put in place before, that they'll still be there, we'll be able to detect it. I mean, it comes from, a lot of the information comes from doctors like yourselves.
Yeah, well, yes. The problem is if it's a new variant, we're not sure what your immune system is going to do. Unfortunately, if it's one of the other sub-variants of the current Omicron going around, we know that a lot of people, whether they have been infected with Omicron earlier this year or been vaccinated, we know that the immune system doesn't last longer than 6 months. So we actually see deterioration of the antibodies before 6 months. But, to make it easier, we look at a 6 months period. So if you look at September, that's the 9th month. So we are actually over the time where the antibodies should start weaning down. And I think it's important for patients to understand this, that you don't get caught in between. Remember, this coming month that we are now moving into is also the month where we see a lot of upper respiratory tract infections regarding sinuses. With the seasonal changes, they are already starting to come in. So again, please, if you're not feeling okay, wear your mask. And if you go into a place where there's a crowd of people, or in any hospital or any other institution that sees a lot of patients, please wear your mask. That is to protect yourself. You never know who and what is sitting there. I still see COVID patients, although it's, it's about 4 a week, it's not a lot, but we don't know who it is who's going to come in with COVID.
Okay. The National Department of Health is saying that, they were going to allow the majority of those reporting structures that have been put in place to now go back to their permanent jobs. We do need people to get back to their permanent jobs. We know from a resource point of view that is required. What's your take on that?
Well, people need to go back, but we also need to understand we're still in the pandemic. It's nowhere being declared that we're out of a pandemic. So would it not be then better for National Department of Health or those, whoever is the employers of those people, to make sure that you at least leave 1 or 2 people permanent at this stage until it's worldwide, globally declared that it's not a pandemic anymore, to keep an eye on what the numbers and the stats are doing. Because at some stage, if we get in a next wave, they will have to go back again. And what did you do? Should it be not employ people, not only for COVID stats, but for the other stats. And is it the time that we also get the stats on HIV, the stats on TB, on a weekly basis or monthly basis, so that the public out there understand what we are dealing with.
Okay, so I get what you're saying. Maybe we should employ those people on a permanent basis and then fill their positions with other people, because, which brings me, my next question has to be then, have we learned anything from this pandemic?
Yes, we learned a lot. I'm always laughing and say, yes, we learned how corrupt we can get and how and all of that. But that's not what we should focus on. We should focus on what did we learn. We learned that our infrastructure was not correct or was not up to standard. And we knew this already before it started, but now it was being proven to us. So infrastructure has been increased and upgraded in certain hospitals, although there's still a lot of provincial hospitals that has got a challenge on this. We have learned that we can all work together. We have learned that public and private sector can work together. We have learned that people, especially healthcare people in the hospitals, are very resilient. They can work long hours. They can do with a lot of things that's not available. They make a plan, and we need to make sure that we strengthen those facilities who is not up to standard, so that we don't get caught again in this. So I think again, all over, we have learned that we can work together, and that's very important.
Okay, fantastic. Thank you so much, medical specialist Dr. Angelique Kutsia there. That's her view on the Health Department's announcement. They're ending the COVID-19 daily reporting. They're going to now report to us on a weekly basis.